Mostly COVID-19 activities around these two things, alcohol and cigarettes, are not very much on the crime. Yes, crime reduction has benefited. It's a question of health. It's a question of health. For instance, if you go to the research done by Professor Nicol, who's based in UCT and is a chair of trauma centers and theaters in Western Cape hospitals, said 2 weeks before the lockdown, they've seen 150 people over the weekend occupying your theaters, occupying your ICUs. And exactly 2 weeks after the lockdown, there were only 40 people instead of 150, which means that gives more space and more facilities in the hospital to the people that need it more than the people that they drink alcohol, they shoot one another, they stab one another and all that. And those people, as they come out of theater and they go to ICU, they don't stay 1 day in the wards, they stay up to 6 months, which means ordinary people that are supposed to be accessing these facilities are blocked by the people who go there in their own choice. Because if you get drunk and you shoot somebody, that is your own choice rather than the person who's sick, rather than the person who suffers of COVID-19. So these are health arguments rather than the crime. Yes, crime has benefited, but look, these arguments are around that. The argument is that if you lift the ban on alcohol, this statement must not be seen as a direction that we're going to take. They say if you lift the ban on alcohol, immediately there will be 5,000 occupied beds in these sensitive areas of health. And at the same time, Minister Mkhize is announcing the figures that are going up. In the 2 days ago, it was the first time that 1,000 was announced. So you open here, 5,000 people they go because they've shot and stabbed one another, and the COVID here. So it's a health argument rather than the crime and people that are enjoying the alcohol. Alcohol must be enjoyed. Responsible, we don't have a problem with those, but we have a problem when it begins to interfere with the rights of other people. Why do people arrested when they found with alcohol in their cars? No. There are two questions. There is alcohol and cigarettes. Alcohol is very clear. You go and read your regulations. Regulations simply say there shall be no transportation of alcohol. That's what the regulation is. Whether it's in your basket, whether it's in your pocket, so long you create some form of transport, you shall not be allowed to transport. So even if you are staying in C section, you want to go and drink in B section, so you would have transported. Says you'll drink it in your own house. Somebody said in your own father's house. So you'll drink it in your own house. Transporting is not allowed. That's your alcohol. As alcohol is allowed that you drink it in your house, cigarettes will be smoked in your house. It's not illegal to smoke the cigarette in your house when it has been there. The only problem is when we found it in a car and you failed to show us where did you get the cigarette. You failed, and when did you get the cigarette? So if you say you have bought the cigarette, here is a receipt, we've got two options there, is to get you and go and get the person who sold the cigarette to you. But if the cigarette was there in your 1,000 loosies and you're smoking home, really, we're not going to come in your house to arrest you, to drink your alcohol. We're not going to come home to arrest you for, but buying the cigarette is illegal. That's why they say, not just the sale, buying too is illegal. So those things should be separated until those regulations are removed, and it will remain offense to do that particular thing. Thanks very much.